I generally speak from the heart, so it's always a little bit of not knowing quite what I'm going to say because I want to come and hear and feel what it is that's going on. So the first thing I'd say is I am delighted, honored, and humbled to share a couple minutes with you. And I know you know that I'm new, so I'm a little less than 2 months here. And one of the things that I am doing and trying to learn my job, learn the new job, learn the organization, is I'm looking around for bright spots, right? And it is absolutely clear to me that this is a bright spot. No doubt about it. And bright spots are super, super important in an organization because these are these sort of little nodes that catalyze us forward, and that's really important. And my sort of initial reaction is twofold. It's one, wow, some phenomenal work, some phenomenal stories, and two, it's thank you. All right, thank you for what you're doing, but I'll be a little more specific than that because I think it's thank you on two different levels of why this is so important. So the first is, if you think about, when I think about, and I've had the opportunity in my career to be and work alongside some phenomenal nurses and phenomenal nurse leaders. And in fact, I would say my first and one of my single best mentors was a very stalwart ICU nurse who took me under her wing, and I think you know how that works. A very young clinician, very young physician leader, and man, she was wonderful. And very, I think you probably understand, very subtly and gently, if I came off path, she sort of knocked me back on. And she'd pull me back when I was going too fast, or she'd push me forward when I needed to be pushed forward. And she had this wonderful way of telling me what I needed to hear when I needed to hear it, right? Without letting me become too defensive. And was just a wonderful, wonderful leader and mentor in my life. And so I've been really blessed in the fact that since the very, very beginning of my career, have been blessed with that very tight, positive, synergistic relationship with nurses. But when I think about what is that thing that sits at the core of nursing, right? I think it's exactly what the theme of this conference is. It's sort of the presence with the patient, right? It's that human-to-human connection with the patient. And if you are a care provider, and it is, it's a little bit unfair if you're a care provider because you get to go into that space that other people don't always get to go. And that's that space when you get between a patient or their family in a period of time when they're super vulnerable. Right? I call them soulful moments in life. Right? You only get a couple soulful moments in life. Maybe when you're married, getting married, you're having a kid, or when you're really sick or you're going to lose someone. Right? I can tell you, I remember when my son, I have 4 kids, 3 daughters. One son, about, I'd say, 8 or 9 years ago, was hospitalized. I remember what that nurse looked like. I remember what she was wearing. I remember the little pins she had. Right? I remember her response when I asked her about pain control. I remember all of that. Do I remember what happened the following 6 months after my son was better? Nope. I don't. So there's something about that connection that is sacred, and you're elevating that and creating and emphasizing the importance of that here today. So that's really, really, really important. So thank you for that. The second thing I want to thank you for is what is now required in the future. Because that presence in the patient is fundamental, it's core, and it's not enough, right? It's not enough for where we are today. Everything that we're being asked for, the requirement now is much greater than just showing up at the patient's bedside. When I look at the professional practice model and the awards that we've just given, I hear advocate, professional, partner, accountable, and leader, right? All those are absolutely, they're not aspirational anymore, they're required. They're required. And I think listening to just the last video, message that basically, the words were leadership, being accountable, being a partner is not about a title, right? It's not about a role. It's not about a formal piece or position in your organization. It's how you show up every day. It's what we bring to the table when we take care of our patients, when we work with our teams. And so it is, it has been a belief, it will, I think, always be a belief of mine that for us to move forward in a meaningful way, this is all about us doing it together. Nurses, physicians, allied health providers, techs, administrators, our community, and our patients. And so those are the fundamental requirements in addition to care provision that we have to bring to the table to do that well. So on that sort of second level, I'll applaud you for elevating that for us. It helps move us forward. Congratulations to our award winners today who've migrated off the stage. But congratulations. Thank you for that. So with that, I would like to, or Maggie, are you going to be introducing? Okay, Laura. Well, very good. So just so you know, Laura is my boss. So if you want to give her a warm welcome, I would appreciate that. Thank you.
Thanks, Matt.